So in the more advanced cases of throat cancer, we have to remove the voice box, which is a quite invasive surgery with a 10-day hospitalization minimum. The patients can't speak for 10 days, they can't eat for 10 days. It's a difficult period to wake up and not being able to speak. They have to start writing, then they have all the complications that are possible. It's quite a hard time. The hardest time for most of them is the radiotherapy, which is really difficult to cope with. So that's the procedure is basically removing the whole voice box, bringing the windpipe forward into the skin so they breathe through the neck, because there's no connection anymore from the windpipe to the mouth. Then for the speech and the technique we are working with, there's a speech valve, which is a small valve like this size. When they close the big hole here, the valve is put through the windpipe into the food pipe or the gullet, and then the air has to escape because they've closed it here. It goes into one-way direction, starts vibrating the gullet, and then they have their sound, and they don't lose their accent, but they sound in a complete different way. Especially for women, it's really hard because they sound really low, so they sound like often mistaken for a man when they do phone conversations, which is psychological, even harder for women.